Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. Every week on this program, I have different guests and we talk about different programs, services, information that I think will be of interest to you and your family. So stay tuned, we're going to be back right after these messages with a new exciting physician for you to meet. Welcome back to Your Health Matters. My guest today is Dr. Jacob Oldham, one of the newest orthopedic surgeons here at KRMC. Thank you for being on the show, Dr. Oldham.
Thank you for having me.
And thank you for coming to Kingman. Boy, did we need you.
Well, we're sure happy to be here.
That's awesome. Now, just to give our audience at the beginning information, while you have joined Dr. Stan Allen and
Dr. Cornelson.
Dr. Cornelson at KRMC Orthopedics.
That's correct.
And their number is going to be on the screen here, so they'll be able to call you when they're ready to, or need you. Of course, we hope nobody has any accidents, but we know that's a part of life.
Right.
So I have a feeling you're going to be busy. Seems to be just in Kingman in general, and like I said, we've had such a shortage, so to have two new orthos here is awesome.
Well, awesome. The other great thing is that with the team approach, all three of us being in the same office, I think we just have a better chance to take care of the needs of the community. Just if I'm not around, one of my other partners will be there to help take care of things, or vice versa, and hopefully that will make the access to care a little bit easier for our patients.
Well, and one of the things I've found as I've gotten to know you and the rest of your team too is that multidisciplinary, that's easy for you to say, approach that you have to healthcare. I mean, it includes the rehabilitation and all of that. It is a team approach that you bring to orthopedics.
Well, absolutely, and really that's the best approach for any healthcare situation is, integrating the patient and their family members and loved ones into the healthcare decision, and then whatever their injury is or whatever's going on, into the rehabilitation of that, along with the nurses and physical therapists and other providers. It's really everyone working together. We tend to have better outcomes.
Absolutely, that's great. Now, you're not new to Kingman or KMC because you've been coming here for a few years now.
I have.
As a locum tenant?
Right, I've been basically helping out with the trauma call coverage over the last 6 years. So I've been here on average 1 weekend a month, or maybe a little bit more. For the last 6 years.
Because you were up at Nellis.
Yes,
Air Force Base.
Yeah, up at the Air Force Base in Las Vegas.
Okay. And let's go back even further a little bit, if you don't mind. We'll talk about your initial training. You started with Mayo, right? You're a Mayo-trained physician.
I went to medical school at the Mayo Clinic.
Okay.
That's right, and graduated in 2000.
Okay.
My initial reason for going to the Mayo Clinic was that they had a great orthopedics program, and that's the field I wanted to go into.
Okay, so you kind of always knew you wanted to be ortho? Or?
Since the time when I decided to go to medical school, that's what I wanted to pursue.
Okay, and when did you decide you wanted to become a doctor?
It was about halfway through my undergraduate education. Prior to that, I planned on going to pilot training, which is why I went to the Air Force Academy.
Okay, so which came first, Mayo or Air Force?
Air Force Academy was my undergraduate training.
Okay.
That's right. And then when I graduated from the Air Force Academy, I had the option of either going to fly fighter jets, well, not really fighter jets, going to fly airplanes, which may have ended up in flying either fighter jets or the bigger tanker transport aircraft, or going to medical school.
Okay.
And for a while during this process, I thought I would go fly for a while and then go back to medical school. But since I decided that I could fly as a hobby down the road, but I couldn't really practice medicine as a hobby.
Right.
That I should go ahead and finish out my education, and then if later on I could go back and pursue aviation if I chose to.
So now, when you went to Mayo, were you still in the military then at that point?
I was.
Okay.
Yeah, they kind of cut me loose for those 4 years as a reservist.
Okay.
On a special duty educational situation.
And then you went back and finished.
That's right.
Okay. So how long were you in the Air Force then?
Well, for the 4 years of the Air Force Academy, and then as a reservist for the 4 years of medical school, and then 14 years after that.
Okay.
So basically from 2000 till, now. This last month.
Yeah, okay, so you did 14 years basically.
Yeah, and I'm actually still in as a reservist.
Okay.
So I will be for the next several years.
Yeah, that's just part of that whole process.
That's right.
So during your active duty military, I understand you did a couple of overseas deployments, right?
I did. I was deployed twice for a little bit over 6 months each time.
Okay.
The first time was to Iraq. That was in 2009, and things were really winding down as far as our involvement. We didn't have nearly the trauma load that we'd had previously, but that was a period that I was in Iraq, and then this most recent deployment was in 2011, and that was to Qatar, which is, it's one of those, it's not a country that was involved really in the war, but it was an area, a staging base.
I was just going to ask, is that kind of where they'd bring the wounded to?
Exactly. They would bring the wounded mostly from Afghanistan at this time. They'd bring them back for us to kind of patch up and maybe get back to the war. If it was a serious trauma that would require getting back to the United States, then they would go straight to Germany.
Oh, okay, to Wiesbaden?
Yeah, those. Or to Landstuhl.
Okay. Okay.
Yeah, they go straight there, and then from there to Walter Reed or some of the other medical centers in America.
Yeah.
So we took care of the types of trauma that we could fix and make those patients better, make those soldiers better, and help keep them in the theater so they could get back to their job and didn't have to come all the way back to America.
Sure, makes sense. Well, so that gave you a lot of hands-on experience. Hopefully you won't have to have that kind of experience here in Kingman. That's
right. That's right.
But so now your specialty in orthopedics now that you're practicing out of the civilian world is sports medicine?
Well, I'm certified in sports subspecialties. So, all kinds of sports injuries to the shoulder, knee, ankle, specifically, usually, but also the elbow and other places.
Okay.
But having said that, being in the Air Force, my practice was very general. I took care of a lot of older patients with arthritis of the hips, knees, shoulders, and we also took care of children, acute typical fracture management and things like that.
So you're going to see the full range.
Yeah, I do kind of a well-rounded practice, which I enjoy. I enjoy the variety.
Good. Yeah, and we've got that here then.
Yes,
that'll be good for you.
There's definitely enough to go around.
Yeah, absolutely. Well, we're glad to have you back in Kingman now and on a permanent basis. That's the other thing that's going to be great. And when we talked about the different not specialties, but the different injuries and things that you see and work on, what do you think are the most common types of injuries that you have to see?
So here in this community, there's a lot of folks that ride dirt bikes and things like that, off-road, horses even, and so we see not just in that population, but also in our elderly population who can maybe fall down. We see a lot of broken wrists. That's probably one of the most common things. One of the other traumas that we take care of a lot of are hip fractures.
Again, from falls.
Again, mostly from elderly folks who fall and break their hip. But beyond that, as far as the sports injury side of it, there are a lot of rotator cuff injuries that we see in the older athletes.
As just the weekend warriors.
The weekend warriors are older athletes. And then other shoulder injuries, you can have sometimes shoulder dislocations that need to be fixed, and typically those happen in the younger athletes.
Okay, yeah. You're getting a little too carried away with too much, too hard, too fast kind of thing.
Yeah.
Are there things that you're seeing or that you would recommend too for patients? Well, preventative, obviously you try to avoid falling, but once they've had an injury, what's the best?
Well, so I think that first off, you talk about preventative. I think that that's a really a big factor. I think in whatever endeavor they're pursuing, if they can make sure that their body's in as good a shape as they can be in, if they can warm up, warm up and stretching will help prevent a lot of injuries. That combined with good core strength and stability, like I said, just being in as good a shape, overall whole body, you know, to do that activity makes a huge difference. There's a reason why we typically see the most injuries at the beginning of a sports season. It's because, you know, the kids, the athletes have been in the off season and maybe aren't in as good a shape as they will be later on. Their balance, their strength isn't as good as they need to protect their joints and their joints, ligaments, and tendons. So I think prevention is a huge part. Then to answer the next question, once a person gets injured, you know, whether that's a sports injury or, you know, maybe just a fall at home, there's a lot of times when these injuries are just either bruises or muscle strains or ligament sprains. And in those settings, you know, the typical protection, rest, elevation, you know, the RICE protocol, exactly. And I would add to that, for a lot of these things, I use the phrase, orthopedics your grandmother would tell you. You know, 50, 100 years ago when there was no such thing as orthopedic surgeons, if you injured yourself, what did grandma say? She said, well, stay off it, protect it, give it some massage, stretch it. And, you know, massage and stretching are, I think, modalities that we often underappreciate.
That, you know, you just makes sense. And if you think about like what you're saying, especially if you're just starting out for the season, you haven't given your body a chance to get used to that. So in every sport,
absolutely,
it doesn't matter if it's football, baseball, or running. I mean,
we call it prehabilitation. You know, getting ready rather than rehabilitation.
Right. So that being proactive instead of reactive. That makes sense. So, have you had a chance yet to maybe go to any of the games here in Kingman and check it out? And
absolutely.
Talk to some of the coaches, making sure they're doing it.
We've my partner, Dr. Cornelson, is also a sports surgeon, sports orthopedic surgeon, and he and I have visited with the athletic directors and football coaching staff of the 3 high schools here in town.
Excellent.
My son actually plays on the Kingman Academy high school team. Well, he's a freshman, so it's his first year in the football, in the sport of football. But so he's part of that team, and so I'm regularly down there and just kind of helping. They have a great staff of coaches, and that can help kind of direct the rehabilitation or the prevention of sports injuries.
Yeah, he's probably out there going, don't let me strain a muscle, my dad'll kill me.
He's been, fortunately he's been healthy.
Good, very good. Well, that's awesome. And again, you know, I can't say enough how blessed we are to have you and Dr. Cornelson here teaming up with Dr. Allen and doing that prevention, because I think that is really critical, both for our young people. And, you know, I think a lot of times people forget about the fact that when they're young, they can have those kind of injuries and bounce back fairly quickly, not realizing that it could have some long-term, might come back to haunt them when they get older. I know my husband has had a number of broken bones in his life, and as he's gotten older now, they just kind of come back to remind him, remember when? Oh, yeah. Arthritis sneaks in and all that.
Yeah, when you're a little bit younger, you have more reserve. You can get around, you know, the mechanics that get messed up when you have an injury like that.
And they don't work as well as we get older. We're going to take a quick break, and then we'll come back and we can talk some more.
Great.
Okay, so stay tuned. We'll be back right after these messages.
We're all dealt a certain hand full of cards.
Right.
And it's up to us to play those cards in the best way.
Welcome back to Your Health Matters. My guest today is Dr. Jacob Oldham, one of the newest orthopedic surgeons here at KRMC. Thanks again for being on the show.
Well, it's my pleasure.
And it's great for me, a pleasure for me to be able to introduce you to the community because, as we said earlier, we are blessed to have you and Dr. Cornelson joining Dr. Allen because, boy, we needed you. It was a challenge. We were so short of orthopedics, so to have the two of you come at the same time is wonderful.
Thank you.
We were talking before the break about preventative and stretching, the importance of doing all of that. Are there, well, we talked about stretching exercises, but do things like yoga or Tai Chi, do those kind of things help with that as well?
Absolutely. Yeah, I'm a great believer that that the joints of the body, the shoulder, the knee, the hip, everything, when we have tightness in those joints, it's kind of like, I don't know if you know much about engines. I know your son works on engines, but so in an engine there's a piston and a cylinder, and that piston glides up and down in the cylinder, and that's where the explosion takes place. And the oil helps get around the outside where the piston and the cylinder meet to keep there from being too much friction in there.
It's like lubrication.
Exactly. Yeah. When your joints are tight, it's kind of like that cylinder being too tight, so the piston can't glide up and down
like
as smoothly. Exactly. And so you get a lot of extra friction in there, and that's that friction over time, that extra pressure over time wears out the cartilage. You're putting a lot of extra load on it. So I think yoga, there's different aspects of yoga. There's the stretching aspects and then also the power aspects, the strengthening. And if we're talking specifically about the range of motion and the flexibility in the stretching aspects, I think those are fantastic.
Okay.
As far as the strengthening aspects, the one thing that's very helpful in that is that it focuses on core stability and strength, which I think are very important to help prevent injuries in other sports and things
as well. And balance too, right?
Balance.
I mean, it's our core
coordination
that we take for granted sometimes. You just assume it's there and it's not.
Yeah.
I know I myself went through the Dizziness and Balance Center that we have here that helped me learn to strengthen, because I for a while went through this period where I was just being graceless and falling frequently. So that's why my mom didn't name me Grace. But they really helped me learn to help find my center more and to try to avoid those falls. But I liked what you're saying too, and it makes sense about that lubrication in the joints. And now, is that something as we age that it just kind of we get less of it?
Absolutely. Right? So you tend to get tighter in the joints as you get older.
Okay.
And which makes, and also your cartilage starts to wear out as you get older. Right. So the two together, the tight joint plus the painful cartilage, they go together and it creates a downward spiral, which if you can work on stretching, you can tend to decrease the amount of symptoms that are associated with arthritis.
Okay.
And you get that with yoga or Tai Chi or just any good stretching regimen.
So even if you already have like arthritis or some of those issues, just taking or doing some of that type of stretching will help?
Absolutely. It helps decrease the amount of pressure that your body has on that section of cartilage on a day-to-day basis. Okay.
Now I know another thing that you do, because you wouldn't remember probably, but a year and a half ago, I had one of the shots in my knee because I have the bone-on-bone arthritis in my one knee right now. And there's that new injection that you can get, I forget
the joint fluid replacement type.
Yeah.
So there's several, we call it viscosupplementation.
Right,
That's a fancy word for joint fluid replacement.
Okay.
But yes, and sometimes that helps people feel better as well. It's essentially like changing the oil in the car. You're putting new fluid in there to help supplement the joint fluid that you have already in your knee joint, or sometimes we do it in the shoulder or the ankle as well.
Okay. I know in my case it lasted for, I'm probably going to have to come see you again soon, but
it's lasted a good while.
Yeah, year and a half. I mean,
that's great.
Yeah, I was surprised.
And it doesn't help everybody.
Right.
It's one thing we've noticed on the joint fluid replacement therapy is some patients, feel great, and you can go a year and a half for you, or if we can get at least 6 months out of it, it's probably worth doing.
That's kind of what I was expecting. I think that's what we talked about initially, was 6 months and probably try again. And then I realized, wow, it's
you're doing pretty well.
Yeah, it's just now starting to kind of remind me,
And with any injection I do, though, I get back to what we were talking about before. The injection will help in the acute setting and make it feel better for some period of time. But if over that period of time you can kind of change some routines, you can take some of the load off by maybe weight loss. You can do more motion, because motion tends to help the joints feel better. Motion is lotion. That's an old orthopedic saying. So you know, get into kind of exercise bike or things like that. Stretching, you know, helping decrease the pressure on the joints. If you can, those are all kind of daily habits, you know, activities that just are part of your life. If you can change those lifestyle issues, eat healthier. You know, I'm a great believer in good, fresh nutrition, fresh fruits and vegetables. I think those help your body to be as healthy as it possibly can. And if you can make those lifestyle changes over the period of time that steroid injection or joint fluid replacement injection is working, then they just tend to last longer, and maybe you never need another one.
Yeah, could be. Yeah, and it makes sense. I hadn't thought about it, but I have been doing all those things, and that's maybe
probably why it's lasted so long. Yeah,
That's
absolutely.
good to know. We'll keep going, keep working at it. So, we talked about the injections. Are there other types of things like that you do in the ortho field?
So we have injections. I mean, you had an injection in your knee, and so we'll do injections in many different places in the body. Areas where there's tendon issues, like in the shoulder for where you have rotator cuff pinching, called impingement, or even in tennis elbow, in the elbow. So we give injections in many different locations. But beyond that, the other modalities that we have are mostly casting and bracing.
Do you do much like carpal tunnel?
So we'll do carpal tunnel releases for people who have a pinching of the nerve at the wrist. Yeah, which is what carpal tunnel is essentially.
Right, yeah, from repetitive types.
Yeah, it can be from repetitive, but we have plenty of people that have carpal tunnel syndrome that have never done anything repetitive on a regular basis. So, you know, I think a lot of it, a lot of who we are as in our personality and in our body as well is a genetic, and we have a genetic predisposition. Exactly, you know, and we're all dealt a certain hand full of cards.
Right.
And it's up to us to play those hands, the handful of cards, in the best way.
Yeah.
And you know, we can do that by some of these lifestyle choices that we talked about. But you know, sometimes these genetic predispositions catch up to us regardless of what we do.
Right. Well, so like arthritis, is that sort of a genetic?
I think it definitely is. You know, we see plenty of people who all their family members tend to have arthritis at a younger age, and now there are some other people who may have arthritis because of an injury, you know, bad injury or things like that. But I think all of those predispositions tend to run in families.
So does arthritis have a tendency to go to weak points? Is that kind of why you end up at the broken bones type of, or what is it?
I don't know if that it necessarily goes to the weak joints, but there are certain joints in the body that take more repetitive load on a day-to-day basis.
And they're more susceptible then.
And those are the ones that typically get it. I mean, there's a reason we replace more knees than we do hips and shoulders.
Okay.
You know, because the knee takes a little bit more of a beating. Exactly. Whereas the hip joint, it doesn't tend to have as much sliding because it's a real ball and socket.
Okay.
It doesn't tend to wear out usually as often.
Right. That's interesting. So, is it more the falls that cause the need for hip replacement then versus?
No, I mean, we do hip replacements for falls if the fracture's in a certain place, and we do either a partial hip replacement or a total hip replacement in that setting. But there's a lot of folks who do get arthritis in the hip as well.
Okay.
And those we deal with those on an outpatient setting. You know, similar to a knee arthritis.
Okay, so the injections will help sometimes with that. Is that what you're?
Although we don't tend to do many injections in the hip. In order to do that,
I think that's a long needle.
It's a long needle, and it's a place where there's a lot of big nerves and blood vessels. And so, if we're going to do an injection in the hip, we send you to see the radiologist.
Okay.
And they do it under a special X-ray called fluoroscopy.
Right. And that's another thing we're blessed with here at KMC.
Yeah, right, we got a great radiology crew.
We do. We've got. Well, we have so many Mayo-trained physicians now. We're just like sub base of Mayo almost. We've got a great group.
Well, I think that, you know, whether it be your training at Mayo or in other places, one of the, I think, good medicine is typically the kind of medicine where folks feel comfortable dealing with each other, the interaction between different fields, and we sure saw that a lot at Mayo, and I'm sure it's that way in many other places.
Right. Well, again, that's that multidisciplinary thought process too. Kind of isn't that sort of the base of Mayo, and they goes back to the Mayo brothers. So
yeah, it was almost comical sometimes when you're at the clinic, because you know, you'd be in the middle of a conversation with a surgeon or with an internal medicine doc, and then all of a sudden their pager would ring, and they'd be like, hold just a minute, and they would answer and basically help consult one of their other partners, and then they would hang it up, and so sometimes those interruptions were a little bit painful to endure.
Yeah, I bet.
But the idea was, you know, it was you could contact any doc at any time for any problem, and they were happy to help you out.
Wonderful. Thank you so much for being on the show. The time has gone so fast, and we'll have to have you back again.
I'd love to.
I hope you learned something new today. I know I did. Join me again next week when we'll have another great guest on the program.